Welcome to our YouTube video on healthcare assistant interview questions and answers. Whether you're preparing for an interview in the NHS or any healthcare setting, this video will provide you with valuable insights and tips to excel in your interview. Throughout this video, we'll be discussing common interview questions you may encounter, along with effective ways to structure your answers using the STAR approach: situation, task, action, and result. By utilizing this framework, you'll be able to provide comprehensive and structured responses that showcase your skills and experiences. So, let's dive in and equip you with the tools you need to ace your healthcare assistant interview. 1. Can you tell us about your previous experience in healthcare? My previous experience in healthcare has provided me with valuable skills and insights that I believe make me well suited for the role of a healthcare assistant. During my time working in healthcare settings, I have had the opportunity to interact directly with patients, providing them with compassionate care and support. I have assisted patients with activities of daily living, such as bathing, dressing, and feeding, ensuring their comfort and well-being. Additionally, I have helped to monitor patients' vital signs, administer medications under supervision, and assist with medical procedures as needed. Through these experiences, I have developed strong communication and interpersonal skills, as well as a deep understanding of the importance of patient-centered care. I am committed to providing high-quality care to each patient I encounter, and I am eager to continue making a positive impact in the healthcare field as a healthcare assistant. 2. What inspired you to pursue a career as a healthcare assistant? What inspired me to pursue a career as a healthcare assistant was my innate desire to make a positive impact on people's lives and contribute to their well-being. Growing up, I witnessed the compassionate care provided by healthcare professionals to my family members during times of illness, which deeply resonated with me. This experience ignited my passion for healthcare and instilled in me a strong sense of empathy and compassion towards others. I realized that becoming a healthcare assistant would allow me to directly support patients in need, provide comfort and assistance during challenging times, and play a meaningful role in improving their quality of life. Every day, I am inspired by the opportunity to make a difference in the lives of those I care for, and I am committed to upholding the values of empathy, compassion, and professionalism in my role as a healthcare assistant. 3. How do you ensure patient confidentiality and privacy? Maintaining patient confidentiality and privacy is paramount in healthcare, and I take several steps to ensure it is upheld at all times. Firstly, I strictly adhere to regulations and other relevant privacy laws, understanding the importance of safeguarding patient information. I am mindful of discussing patient information only in private and secure environments, away from unauthorized individuals. Additionally, I limit access to patient records and information only to those who are directly involved in the patient's care, ensuring that sensitive information is not shared unnecessarily. I also utilize secure communication methods, such as encrypted emails or secure messaging platforms, when discussing patient-related matters with colleagues or other healthcare professionals. Furthermore, I am diligent about maintaining the confidentiality of patient information in both electronic and physical formats, ensuring that records are stored securely and not left unattended or accessible to unauthorized individuals. I also undergo regular training and education on patient confidentiality practices to stay updated on best practices and guidelines. 4. What do you understand about the role of a healthcare assistant in the NHS? As a healthcare assistant in the NHS, I understand that my role is multifaceted and crucial to the delivery of high-quality patient care. Firstly, I recognize that I am an integral part of the healthcare team, working alongside nurses, doctors, and other professionals to support patients in various clinical settings. My responsibilities include providing direct care and assistance to patients with activities of daily living, such as bathing, dressing, and feeding, while ensuring their comfort and dignity are maintained. I also assist with basic medical procedures, such as taking vital signs, changing dressings, and administering medications under supervision. Additionally, I play a vital role in promoting patient safety by observing and reporting any changes in patients' conditions to the nursing staff, participating in infection control measures, and maintaining accurate documentation of care provided. Overall, as a healthcare assistant in the NHS, I understand that my role is to provide compassionate, patient-centered care and support to individuals across the lifespan, contributing to positive health outcomes and enhancing the overall patient experience. 5. How do you prioritize tasks when caring for multiple patients? Prioritizing tasks when caring for multiple patients requires a thoughtful and organized approach to ensure that each individual receives timely and appropriate care. Firstly, I assess the acuity of each patient's condition, prioritizing those with more urgent needs such as critical care or imminent medical issues. This ensures that the most critical cases receive immediate attention and intervention. Next, I consider factors such as the complexity of care, required, scheduled procedures or treatments, and each patient's individual care plan. By understanding the specific needs of each patient, I can allocate my time and resources effectively to address their priorities. Communication with the healthcare team is also crucial in prioritizing tasks. I collaborate closely with nurses, physicians, and other support staff to coordinate care, share important information, and identify any changes in patient status that may require immediate attention. Flexibility is key in adapting to changing circumstances or emergencies that may arise throughout the shift. I remain vigilant and responsive to the needs of all patients under my care, adjusting my priorities as necessary to ensure that everyone receives the attention and support they require. 6. Describe a challenging situation you faced in a previous healthcare role and how you resolved it. In a previous healthcare role, I encountered a challenging situation when a patient's family member became upset and agitated due to concerns about the patient's care plan. The family member felt that the plan wasn't adequately addressing the patient's needs and was demanding immediate changes. To resolve the situation, I first listened attentively to the family member's concerns, allowing them to express their frustrations and fears. I empathized with their emotions and assured them that their feedback was valued and that we would work together to address the issues. Next, I communicated effectively with the healthcare team, including the nursing staff and the patient's physician, to discuss the family member's concerns and develop a revised care plan that better met the patient's needs. I advocated for the patient's preferences and collaborated with the team to implement the necessary changes. Throughout the process, I maintained open and transparent communication with the family member, providing regular updates on the patient's progress and involving them in decision-making whenever possible. By actively listening, collaborating with the healthcare team, and prioritizing patient-centered care, I was able to successfully resolve the challenging situation and ensure that the patient received the best possible care. 7. How do you handle stressful situations in a healthcare environment? In a healthcare environment, I handle stressful situations by employing several strategies to maintain composure and ensure effective patient care. First and foremost, I prioritize remaining calm and focused, as panic or anxiety can hinder my ability to think clearly and make rational decisions. I take deep breaths and remind myself of the importance of staying composed for the benefit of the patients and my colleagues. Next, I rely on my training and experience to assess the situation quickly and determine the most appropriate course of action. This may involve prioritizing tasks, delegating responsibilities to other team members, or seeking assistance from supervisors or more experienced healthcare professionals. I also make use of coping mechanisms such as positive self-talk, visualization, or brief breaks when possible to alleviate stress and maintain mental well-being. Additionally, I find support from colleagues invaluable during stressful times, as we can lean on each other for guidance, encouragement, and emotional support. After the stressful situation has passed, I take time to reflect on the experience, identifying any lessons learned or areas for improvement. This reflection helps me to grow personally and professionally, ensuring that I am better prepared to handle similar situations in the future. 8. Can you explain your understanding of infection control and prevention? Infection control and prevention are fundamental aspects of healthcare, aimed at minimizing the spread of infections within healthcare settings and protecting both patients and healthcare workers. My understanding of infection control involves a multifaceted approach that encompasses various strategies and practices to prevent the transmission of pathogens. Firstly, I prioritize strict adherence to hand hygiene protocols, including regular hand washing with soap and water or using alcohol. based hand sanitizers, especially before and after patient contact, and after any potential exposure to bodily fluids or contaminated surfaces. Additionally, I understand the importance of maintaining a clean and sanitary environment by routinely cleaning and disinfecting patient care areas, equipment, and frequently touched surfaces, using appropriate disinfectants and following established cleaning protocols. Furthermore, I recognize the significance of using personal protective equipment (PPE) correctly and consistently to protect both myself and patients from exposure to infectious agents. This includes wearing gloves, masks, gowns, and eye protection as necessary, depending on the nature of the task and the level of risk. Moreover, I understand the importance of implementing transmission-based precautions when caring for patients with known or suspected infections, such as using isolation precautions and following specific infection control protocols to prevent the spread of pathogens. 9. What measures do you take to ensure patient safety? Ensuring patient safety is a top priority in my role as a healthcare assistant. I take several measures to uphold this commitment. Firstly, I maintain strict adherence to infection control protocols, including proper hand hygiene, use of personal protective equipment, and environmental cleaning. Additionally, I carefully follow established procedures and guidelines when providing patient care, such as double-checking medication administration and verifying patient identification before any procedure. I prioritize effective communication with patients and their families, ensuring they understand their care plans and any potential risks involved. Regular monitoring of patients' vital signs and promptly reporting any changes to the nursing staff is also essential for early intervention. Lastly, I actively participate in team discussions and safety huddles, where we review potential safety concerns and collaboratively develop strategies to address them. By consistently implementing these measures, I contribute to creating a safe and secure environment for patients, promoting positive health outcomes and enhancing their overall experience. 10. How do you approach patients who may be anxious or frightened? Approaching anxious or frightened patients requires a compassionate and empathetic approach, aimed at establishing trust and providing reassurance. Firstly, I approach the patient calmly and respectfully, introducing myself and acknowledging their feelings without judgment. I strive to create a safe and supportive environment where the patient feels comfortable expressing their concerns and fears. Active listening is crucial in understanding the root cause of the patient's anxiety or fear. I encourage the patient to share their thoughts and feelings, validating their emotions and offering empathy. By actively listening, I can address specific concerns and tailor my approach to meet the patient's needs. Next, I provide clear and honest communication about the situation, explaining any procedures or treatments in a simple and understandable manner. I offer information about what to expect, including potential sensations or discomfort, and reassure the patient that they are not alone in their experience. Using calming techniques such as deep breathing exercises, gentle touch, or soothing music can also help alleviate anxiety and promote relaxation. I remain patient and supportive throughout the interaction, offering encouragement and praise for the patient's bravery and resilience. 11. Describe your experience with assisting patients with activities of daily living. In my experience as a healthcare assistant, I've had extensive involvement in assisting patients with activities of daily living (ADLs). This includes tasks such as bathing, dressing, grooming, toileting, feeding, and mobility assistance. I approach these tasks with compassion, empathy, and respect for each patient's dignity and independence. I prioritize establishing trust and rapport with patients, ensuring they feel comfortable and supported throughout the process. I communicate clearly and respectfully, explaining each step of the ADL assistance and encouraging patient participation to the extent possible. I adapt my approach based on the unique needs and preferences of each patient, recognizing that individuals may require different levels of assistance or support. I also pay close attention to any signs of discomfort or distress, modifying my approach as needed to ensure the patient's safety and well-being. Additionally, I maintain professionalism and confidentiality at all times, respecting the privacy of patients during ADL assistance and maintaining appropriate boundaries. Through my experience, I've developed strong skills in ADL assistance, enabling me to provide compassionate and effective care that meets the physical and emotional needs of each patient. 12. How do you maintain accurate documentation of patient care activities? Maintaining accurate documentation of patient care activities is essential for ensuring continuity of care, promoting patient safety, and complying with healthcare regulations. To achieve this, I adhere to strict protocols and guidelines established by my organization. Firstly, I ensure that all documentation is completed promptly and accurately, following standardized formats and procedures. This includes recording vital signs, medication administration, treatment interventions, and any observations or changes in the patient's condition. I also prioritize detail-oriented documentation, providing clear and concise descriptions of each patient interaction or procedure. This helps to ensure that the information captured is thorough and easily understandable for other healthcare professionals involved in the patient's care. Additionally, I make use of electronic health record systems or paper-based charts, depending on the facility's practices, to document patient care activities. I ensure that all entries are time-stamped and signed appropriately to maintain accountability and traceability. Regular audits and reviews of documentation are also conducted to identify any discrepancies or areas for improvement. This allows me to address any issues promptly and ensure that documentation practices are consistently accurate and up to date. 13. Can you give an example of a time when you had to work as part of a multidisciplinary team? I recall a situation during my previous role where a patient with complex care needs required the input of multiple healthcare professionals. The patient had recently undergone surgery and required post-operative care, including wound management, pain management, and physical therapy. As part of the multidisciplinary team, I collaborated closely with nurses, physicians, physical therapists, and other healthcare professionals to ensure comprehensive care for the patient. We held regular team meetings to discuss the patient's progress, update care plans, and address any challenges or concerns. For example, there was a particular instance where the patient experienced a setback in their recovery due to post-operative complications. In response, the multidisciplinary team came together to reassess the patient's care plan, adjust medications, implement additional interventions, and provide emotional support to the patient and their family. Through effective communication, collaboration, and coordination of care among team members, we were able to address the patient's needs holistically and facilitate their recovery. The multidisciplinary approach not only ensured that the patient received comprehensive care, but also optimized the efficiency and effectiveness of our efforts. 14. How do you communicate effectively with patients who have communication difficulties? Communicating effectively with patients who have communication difficulties requires patience, empathy, and adaptability. Firstly, I prioritize establishing trust and rapport by approaching each patient with kindness and understanding. I use clear and simple language, avoiding medical jargon, and ensure that I maintain eye contact and speak at a pace that is comfortable for the patient. Additionally, I utilize nonverbal communication cues, such as gestures and facial expressions, to convey empathy and support. It's crucial to actively listen to the patient's responses and provide them with ample time to express themselves, even if it takes longer than usual. If necessary, I explore alternative communication methods, such as writing notes, using picture boards, or employing assistive devices like communication apps or speech-generating devices. Lastly, I involve family members or caregivers in the communication process, as they may provide valuable insights into the patient's preferences and needs. By employing these strategies, I ensure that patients with communication difficulties feel respected, heard, and involved in their care. 15. What steps do you take to promote dignity and respect for patients? Promoting dignity and respect for patients is a fundamental aspect of healthcare assistance, and I take several steps to ensure that every individual under my care feels valued and respected. Firstly, I prioritize clear and open communication, treating each patient with kindness, empathy, and sensitivity to their unique needs and preferences. I always maintain confidentiality and privacy, respecting the patient's right to autonomy and informed decision-making. I involve patients in their care decisions, actively listening to their concerns and preferences, and empowering them to participate in discussions about their health and treatment options. Additionally, I pay attention to nonverbal cues and body language, ensuring that my interactions convey warmth, respect, and understanding. I provide assistance with activities of daily living in a manner that preserves the patient's dignity and independence, offering support while respecting their personal boundaries and preferences. Creating a welcoming and inclusive environment is also essential in promoting dignity and respect for patients. I strive to cultivate a culture of diversity and acceptance, celebrating each patient's individuality and cultural background while fostering a sense of belonging and mutual respect among staff and patients alike. 16. Describe your knowledge of basic first aid procedures. Basic first aid procedures are essential skills for a healthcare assistant. My knowledge of basic first aid procedures includes assessing the scene for safety, checking for responsiveness, and calling for emergency medical assistance when necessary. I am trained in performing cardiopulmonary resuscitation (CPR) and using an automated external defibrillator aid in case of cardiac arrest. Additionally, I am familiar with treating common injuries such as cuts, burns, and sprains by cleaning and bandaging wounds, applying cold packs, and immobilizing injured limbs. I also understand the importance of controlling bleeding and managing shock in emergency situations. Overall, my knowledge of basic first aid procedures enables me to respond effectively to medical emergencies and provide immediate assistance to patients in need. 17. How do you handle situations where a patient refuses treatment or assistance? When a patient refuses treatment or assistance, I approach the situation with empathy, patience, and respect for their autonomy. My first step is to listen carefully to their concerns and reasons for refusing. I acknowledge their perspective and validate their feelings, while also gently exploring their reasons for refusal to better understand their needs. Next, I provide education and information about the importance of the treatment or assistance being offered, emphasizing the potential benefits and addressing any misconceptions or fears they may have. I strive to empower the patient to make informed decisions about their care by offering alternative options or compromises that align with their preferences and values. If the patient's refusal poses a risk to their health or safety, I escalate the situation to a supervisor or healthcare provider for further assessment and intervention. However, I always prioritize maintaining the patient's dignity and autonomy throughout the process, ensuring that they feel heard and respected regardless of their decision. 18. Can you discuss your experience with assisting in patient assessments? Throughout my experience as a healthcare assistant, I've had the opportunity to assist in patient assessments under the supervision of registered nurses or other healthcare professionals. Patient assessments are crucial for identifying their needs, monitoring their health status, and informing their care plans. During patient assessments, I typically assist with tasks such as obtaining vital signs, including temperature, blood pressure, pulse rate, and respiratory rate. I also assist with measuring and recording other relevant parameters such as weight, height, and oxygen saturation levels. Additionally, I often gather information about the patient's medical history, current symptoms, and any changes in their condition since the last assessment. I communicate closely with patients to understand their concerns, comfort levels, and any new developments they may have experienced. Moreover, I assist in physical examinations by helping to position the patient, providing support as needed, and ensuring their comfort and privacy throughout the process. I also observe and report any notable findings or changes in the patient's condition to the supervising healthcare professional promptly. Overall, my experience with assisting in patient assessments has allowed me to develop skills in gathering data, communicating effectively with patients, and collaborating with the healthcare team to ensure thorough and accurate assessments. It's a vital aspect of my role as a healthcare assistant in providing quality care and supporting patient well-being. 19. How do you ensure a clean and safe environment for patients? Ensuring a clean and safe environment for patients is essential for their well-being and recovery. Firstly, I adhere strictly to infection control protocols, including proper hand hygiene, wearing appropriate personal protective equipment, and following established cleaning procedures for patient rooms and common areas. I regularly sanitize high-touch surfaces and equipment to prevent the spread of infections. Additionally, I maintain a clutter-free environment, ensuring that walkways are clear and easily accessible for patients with mobility issues. I also actively monitor the environment for potential safety hazards, such as spills or loose cables, and promptly address them to prevent accidents. Collaboration with the environmental services team is crucial for maintaining cleanliness and ensuring that all areas are properly sanitized. By consistently implementing these measures, I contribute to creating a safe and comfortable environment where patients can receive care with confidence. 20. What do you do if you suspect a patient is experiencing abuse or neglect? If I suspect that a patient is experiencing abuse or neglect, my immediate priority is to ensure the safety and well-being of the individual. Firstly, I would approach the situation with sensitivity and empathy, creating a safe space for the patient to disclose any concerns or experiences they may have. I would then document my observations and any relevant information, ensuring accuracy and detail to support further investigation. It's crucial to handle the situation with confidentiality and professionalism, respecting the patient's right to privacy while also fulfilling my duty to report suspected abuse or neglect. Next, I would follow the established protocols and procedures within the healthcare facility for reporting such incidents. This may involve notifying a supervisor, nurse, or designated safeguarding officer, who can initiate appropriate action and ensure the patient receives the support and protection they need. Throughout the process, I would continue to offer emotional support and reassurance to the patient, emphasizing that they are not alone and that help is available. I would also collaborate with other members of the healthcare team to ensure a coordinated response and follow-up care for the patient. 21. Can you describe your experience with using medical equipment and devices? My experience with using medical equipment and devices includes familiarity with a range of tools commonly used in healthcare settings. This encompasses basic devices such as blood pressure cuffs, thermometers, and pulse oximeters, which I regularly use to monitor patients' vital signs. I am also proficient in operating more specialized equipment, such as nebulizers for respiratory treatments, glucometers for blood glucose monitoring, and electrocardiogram (ECG) machines for cardiac assessments. Additionally, I have experience with mobility aids such as wheelchairs, walkers, and transfer lifts, which I use to assist patients with mobility limitations. Throughout my experience, I prioritize patient safety and comfort, ensuring that all equipment is properly calibrated, sanitized, and used according to manufacturer guidelines. 22. How do you maintain professionalism and boundaries with patients? Maintaining professionalism and boundaries with patients is paramount in healthcare settings to ensure ethical practice and maintain trust. I uphold professionalism by adhering to the highest standards of conduct, ethics, and confidentiality. This includes maintaining a respectful and non-judgmental attitude towards all patients, regardless of their background or circumstances. I establish clear boundaries by maintaining appropriate physical, emotional, and social distance with patients. This involves refraining from personal disclosures, maintaining professional attire, and avoiding any behavior that could be perceived as crossing professional boundaries. I communicate with patients in a professional manner, using language that is clear, respectful, and sensitive to their needs. I also ensure that I obtain proper consent before providing care or discussing sensitive information, respecting the patient's autonomy and right to privacy. In situations where boundaries may be tested, such as dealing with challenging behaviors or personal disclosures from patients, I respond calmly and assertively, reaffirming the boundaries while still providing compassionate care. 23. What do you understand about safeguarding vulnerable adults? Safeguarding vulnerable adults is a critical responsibility within healthcare, aimed at protecting individuals who may be at risk of harm or abuse due to their age, disability, illness, or other factors. My understanding of safeguarding vulnerable adults involves several key principles and practices. Firstly, it involves recognizing and identifying signs of abuse, neglect, or exploitation, including physical, emotional, financial, sexual, or institutional abuse. This requires being vigilant and observant of changes in behavior, unexplained injuries, or other indicators that may suggest mistreatment. Secondly, safeguarding vulnerable adults involves responding promptly and appropriately to concerns or suspicions of abuse. This includes reporting any suspected cases to the appropriate authorities, such as social services or safeguarding teams. and cooperating fully with investigations to ensure the safety and well-being of the individual. Additionally, it involves taking proactive measures to prevent abuse and protect vulnerable adults from harm. This may include implementing policies and procedures for staff training, supervision, and risk assessment, as well as promoting a culture of dignity, respect, and empowerment within healthcare settings. Furthermore, safeguarding vulnerable adults requires working collaboratively with other professionals and agencies, including healthcare providers, social workers, law enforcement, and advocacy groups, to coordinate efforts and provide comprehensive support to those at risk. 24. Describe a time when you had to adapt to a change in patient care plans. In a previous role, I encountered a situation where a patient's condition unexpectedly deteriorated, requiring a change in their care plan. Initially, the patient was scheduled for discharge as they were showing signs of improvement. However, their condition worsened suddenly, necessitating a reassessment of their care needs. In response to this change, I quickly adapted by communicating with the nursing staff and other members of the healthcare team to discuss the new care requirements. We collaborated to develop a revised care plan that addressed the patient's current condition and provided the necessary interventions to stabilize them. I prioritized the patient's safety and comfort throughout the process, ensuring that they received the appropriate medical attention and support. By remaining flexible and responsive to changes in the patient's condition, we were able to provide timely and effective care, ultimately leading to a positive outcome for the patient. 25. How do you handle conflicts or disagreements with colleagues? Handling conflicts or disagreements with colleagues requires effective communication, professionalism, and a willingness to seek resolution collaboratively. Firstly, I approach the situation calmly and respectfully, acknowledging differing perspectives without assigning blame or becoming defensive. I prioritize active listening, seeking to understand the root cause of the conflict and the concerns of all parties involved. By validating emotions and perspectives, I demonstrate empathy and create a supportive environment for open dialogue. Next, I strive to find common ground and explore potential solutions together with my colleagues. This may involve brainstorming ideas, compromising on certain aspects, or seeking input from other team members to reach a mutually acceptable resolution. Maintaining professionalism is essential throughout the process, refraining from personal attacks or negative language and focusing on addressing the issue constructively. I remain flexible and adaptable, willing to adapt my approach or perspective as needed to reach a positive outcome. If necessary, I am also open to seeking guidance or mediation from a supervisor or HR representative to facilitate resolution and prevent further escalation of the conflict. 26. Can you discuss your understanding of diversity and inclusion in healthcare? My understanding of diversity and inclusion in healthcare is rooted in the recognition that every individual, regardless of their background, identity, or characteristics, deserves equitable access to high-quality care. Diversity encompasses a broad spectrum of factors, including race, ethnicity, gender, sexual orientation, religion, age, socioeconomic status, and ability. Inclusive healthcare practices involve creating an environment where all patients feel respected, valued, and supported, regardless of their differences. This includes providing culturally competent care that takes into account patients' unique beliefs, values, and preferences. It also involves actively addressing systemic barriers to healthcare access and advocating for policies that promote health equity for marginalized communities. As a healthcare assistant, I strive to uphold principles of diversity and inclusion by treating every patient with dignity, respect, and empathy, and by advocating for their rights and well-being. 27. Describe your approach to providing emotional support to patients and their families. My approach to providing emotional support to patients and their families is rooted in empathy, compassion, and active listening. I recognize that healthcare can be a challenging and emotional experience for patients and their loved ones, and I strive to create a supportive environment where they feel heard, understood, and validated. First and foremost, I take the time to listen attentively to patients and their families, allowing them to express their feelings, concerns, and fears without judgment. I provide reassurance and validation of their emotions, acknowledging the difficulties they may be facing and offering empathy and understanding. I also offer practical support by providing information and resources to help patients and families cope with their situation. This may involve explaining medical procedures, discussing treatment options, or connecting them with support groups or counseling services. Additionally, I maintain open communication with patients and families, keeping them informed about their care plan, treatment progress, and any changes in their condition. This helps to alleviate anxiety and uncertainty and promotes trust and collaboration in the healthcare process. Overall, my goal is to create a compassionate and supportive environment where patients and their families feel empowered, validated, and supported throughout their healthcare journey. 28. How do you prioritize your own well-being while caring for others? Prioritizing my own well-being while caring for others is essential to ensure that I can provide effective and compassionate care consistently. I employ several strategies to maintain my well-being while fulfilling my responsibilities as a healthcare assistant. Firstly, I recognize the importance of setting boundaries and managing my workload effectively. I prioritize tasks based on urgency and importance, ensuring that I allocate time for breaks and self-care activities throughout the day. This helps prevent burnout and allows me to recharge both physically and emotionally. Additionally, I make time for activities that promote my overall well-being, such as exercise, hobbies, and spending time with loved ones. These activities help me relax, de-stress, and maintain a healthy work-life balance. Furthermore, I practice self-care techniques such as mindfulness, meditation, and deep breathing exercises to manage stress and maintain emotional resilience. These practices enable me to stay grounded and focused even during challenging situations. Moreover, I seek support from colleagues, supervisors, and other professionals when needed. Whether it's discussing concerns or seeking advice, having a support system in place helps me cope with the demands of the job more effectively. 29. Can you give an example of a time when you provided excellent patient-centered care? In a recent instance, I was assigned to care for a patient who was feeling particularly anxious and distressed about their upcoming procedure. Recognizing the importance of providing patient-centered care, I took the time to sit down with the patient and listen attentively to their concerns. I offered emotional support and reassurance, explaining the procedure in detail and addressing any questions or uncertainties they had. Additionally, I collaborated with the nursing staff to ensure that the patient's preferences and comfort were prioritized throughout the process. I encouraged the patient to express their needs and preferences, empowering them to take an active role in their care. As a result of this patient-centered approach, the patient felt more at ease and confident about the procedure, which ultimately contributed to a smoother and more positive experience for them. 30. How do you stay updated on current healthcare practices and guidelines? To stay updated on current healthcare practices and guidelines, I employ several strategies. Firstly, I regularly participate in professional development opportunities such as workshops, seminars, and conferences related to healthcare. These events provide valuable insights into emerging trends, best practices, and evidence-based approaches in the field. I also make use of online resources and reputable healthcare publications to access the latest research findings, clinical guidelines, and industry updates. Subscribing to professional journals, newsletters, and online forums allows me to stay informed about advancements in healthcare and relevant changes in regulations or protocols. Furthermore, I actively engage with my colleagues and members of the healthcare team to exchange knowledge and share experiences. Collaborative learning fosters a culture of continuous improvement and allows me to benefit from diverse perspectives and expertise within the healthcare community. Lastly, I prioritize ongoing education and training opportunities provided by my employer, taking advantage of internal programs in services and skill building workshops to enhance my knowledge and proficiency in various aspects of healthcare practice. 31. Can you discuss your experience with assisting patients with medication management? My experience with assisting patients with medication management involves several key responsibilities. Firstly, I ensure that patients receive their prescribed medications in a timely and accurate manner by following medication schedules and dosage instructions provided by healthcare professionals. This includes administering medications orally, topically, or via other routes as prescribed. Additionally, I educate patients about their medications, explaining the purpose, dosage, and potential side effects to promote understanding and adherence. I also assist patients with organizing their medications, including setting up pill organizers or administering pre-packaged medication doses when necessary. Safety is paramount in medication management, and I adhere strictly to medication administration protocols, including verifying patient identities, checking medication labels for accuracy, and documenting administration accurately in patient records. Furthermore, I monitor patients for any adverse reactions or changes in condition following medication administration, promptly reporting any concerns to the healthcare team for further evaluation. Overall, my experience with assisting patients with medication management has honed my attention to detail, communication skills, and commitment to patient safety, ensuring that patients receive the highest standard of care in medication administration. 32. Describe your understanding of health and safety regulations in a healthcare setting. My understanding of health and safety regulations in a healthcare setting is rooted in ensuring the well-being and protection of both patients and healthcare workers. These regulations encompass a wide range of guidelines and protocols designed to minimize the risk of injury, illness, and the spread of infection within the healthcare environment. Firstly, I prioritize infection control measures, including proper hand hygiene, use of personal protective equipment (PPE), and adherence to isolation precautions when necessary. I also maintain a clean and sanitary environment by following established cleaning and disinfection protocols for patient rooms, equipment, and common areas. Additionally, I am vigilant in identifying and reporting hazards or potential risks to health and safety, such as faulty equipment or environmental hazards. I actively participate in workplace safety training and education to stay informed about relevant regulations and best practices. Furthermore, I understand the importance of patient safety protocols, such as medication safety, patient identification, and fall prevention measures. I ensure that I follow these protocols rigorously to prevent errors and promote the well-being of patients under my care. Overall, my understanding of health and safety regulations in a healthcare setting is centered on promoting a culture of safety, accountability, and continuous improvement to ensure the highest standards of care for patients and healthcare workers alike. 33. How do you handle situations where a patient is in pain or discomfort? When a patient is in pain or discomfort, my priority is to address their needs promptly and effectively while ensuring their comfort and well-being. Firstly, I approach the situation with empathy and compassion, acknowledging the patient's pain and validating their experience. I encourage open communication, allowing the patient to express their feelings and concerns while actively listening to their needs. Next, I assess the source and severity of the pain through careful observation and communication with the patient. This may involve asking specific questions about the location, intensity, and character of the pain to gain a better understanding of their condition. Based on the assessment, I collaborate with the healthcare team to develop and implement an appropriate plan of care to manage the patient's pain. This may include administering pain relief medications as prescribed, applying comfort measures such as ice packs or heat therapy, or providing emotional support through reassurance and therapeutic communication. Throughout the process, I continuously monitor the patient's response to interventions and adjust the plan of care as needed to ensure optimal pain management and comfort. I also educate the patient about self-care strategies they can use to alleviate pain and promote their well-being, empowering them to take an active role in managing their symptoms. 34. Can you discuss your experience with infection control procedures, including hand hygiene? In my role as a healthcare assistant, I prioritize infection control procedures, including strict adherence to hand hygiene protocols. I understand the critical importance of preventing the spread of infections in healthcare settings, both for patient safety and staff well-being. I consistently follow proper hand hygiene practices, including washing my hands with soap and water, or using hand sanitizer before and after patient contact, after touching potentially contaminated surfaces, and before performing any invasive procedures. Additionally, I ensure that I follow all other infection control measures, such as wearing appropriate personal protective equipment, maintaining a clean environment, and practicing safe handling and disposal of medical waste. I stay updated on current infection control guidelines and procedures through regular training and education sessions, ensuring that I am equipped with the knowledge and skills necessary to maintain a safe and hygienic environment for patients and staff alike. 35. How do you ensure effective communication with non-English speaking patients? Ensuring effective communication with non-English speaking patients is essential for providing quality care and promoting patient satisfaction. To achieve this, I employ various strategies tailored to the individual's language and communication preferences. Firstly, I utilize interpreter services or bilingual staff members whenever possible to facilitate clear and accurate communication. These resources help bridge the language barrier and ensure that the patient's needs and concerns are fully understood. When an interpreter is not available, I rely on nonverbal communication techniques such as gestures, facial expressions, and body language to convey information and establish rapport. I also use visual aids such as pictures, diagrams, or written instructions to supplement verbal communication and enhance understanding. Additionally, I take the time to learn basic phrases and greetings in the patient's language, which can help build trust and create a more welcoming environment. Simple phrases such as hello, thank you, and how are you feeling demonstrate respect for the patient's culture and language. Throughout the interaction, I speak slowly and clearly, using simple language and avoiding medical jargon or complex terminology. I encourage the patient to ask questions and seek clarification if needed, ensuring that they feel empowered and involved in their care. 36. Describe a time when you had to respond to a medical emergency. One specific incident comes to mind when I had to respond to a medical emergency during my time working at a residential care facility. I was assisting another patient when I noticed one of our residents, an elderly gentleman, showing signs of distress. He was clutching his chest, struggling to breathe, and appeared very pale and sweaty. Recognizing these as potential symptoms of a heart attack, I immediately alerted the nurse on duty while ensuring that the patient was in a safe position, lying down to prevent him from falling. I quickly gathered the necessary emergency equipment, including an oxygen tank and a first aid kit, and returned to the patient's side. The nurse arrived shortly after, and we worked together to assess the situation. She confirmed my suspicion of a heart attack, and I assisted her in administering oxygen to help ease the patient's breathing. Meanwhile, I followed the emergency protocol by calling emergency services and providing them with critical information: the patient's symptoms, current condition, and our exact location. While waiting for the paramedics, I continuously monitored the patient's vital signs, keeping him calm by talking to him gently and reassuring him that help was on the way. When the paramedics arrived, I provided them with a detailed report of the situation and the interventions we had already performed. This clear and concise handover ensured they could take over efficiently and provide the necessary advanced care. Reflecting on this experience, it underscored the importance of remaining calm and composed during emergencies, acting swiftly, and working collaboratively with healthcare professionals. The training and drills we regularly conducted at the facility played a crucial role in preparing us for such situations, ensuring we knew exactly what to do and how to prioritize the patient's safety and well-being. 37. How do you handle confidential patient information in accordance with GDPR regulations? Handling confidential patient information in accordance with GDPR regulations involves strict adherence to data protection principles and practices. I ensure that patient information is collected, processed, and stored securely and only accessed by authorized personnel. Firstly, I follow the principles of data minimization and purpose limitation, ensuring that only necessary information is collected and used solely for the intended purpose. I am careful to obtain explicit consent from patients before collecting their data, and I make sure they are informed about how their information will be used and stored. I ensure that all patient information is kept secure, both physically and digitally. Physical records are stored in locked cabinets, and digital records are protected with strong passwords and encryption. I am diligent about logging out of systems when not in use and ensuring that screens are not visible to unauthorized individuals. I also follow strict confidentiality protocols, only sharing patient information with other healthcare professionals, on a need-to-know basis and always within the confines of GDPR regulations. When discussing patient information, I do so in private settings to avoid unauthorized disclosure. In case of any data breaches or suspected breaches, I promptly report them to the appropriate authorities and follow established procedures to mitigate any potential harm. Overall, I am committed to maintaining the confidentiality and security of patient information in accordance with GDPR regulations, ensuring patients' trust and compliance with legal requirements. 38. Can you discuss your experience with providing care to patients with dementia or cognitive impairments? In my experience providing care to patients with dementia or cognitive impairments, I have developed a compassionate and patient-centered approach tailored to their unique needs. I prioritize creating a safe and supportive environment by reducing potential hazards and using clear signage to aid orientation. Effective communication is crucial, so I use simple language, speak slowly, and maintain eye contact to help patients understand and respond. I also pay close attention to nonverbal cues and body language, as these can provide insights into their feelings and needs. I engage patients in activities that promote cognitive stimulation and emotional well-being, such as memory games, music therapy, and light physical exercises. These activities are designed to enhance their quality of life and maintain their cognitive function. Additionally, I provide consistent routines to help reduce anxiety and confusion, ensuring that daily activities like meals and personal care are predictable and comforting. I also work closely with family members and caregivers to understand the patient's history, preferences, and behaviors, which helps tailor my care approach to their individual needs.
39. Describe your approach to supporting patients with mobility challenges. Supporting patients with mobility challenges requires a compassionate and patient-centered approach. I begin by assessing each patient's individual needs and capabilities, often in collaboration with the nursing staff and physical therapists. My goal is to ensure their safety while promoting as much independence as possible. I use assistive devices such as walkers, wheelchairs, and gait belts to facilitate safe movement. I provide physical assistance, offering support and guidance during transfers and ambulation, always using proper body mechanics to prevent injury to both the patient and myself. I also encourage patients to engage in prescribed exercises to improve their strength and mobility, offering encouragement and positive reinforcement to boost their confidence. Communication is key, so I ensure that patients understand each step of the process and feel comfortable voicing any concerns. By prioritizing their safety and dignity, I help patients maintain their mobility and enhance their overall quality of life.
40. How do you maintain patient dignity during personal care tasks? Maintaining patient dignity during personal care tasks is crucial, and I take several steps to ensure this. First, I approach each task with empathy and respect, recognizing the patient's vulnerability and prioritizing their comfort and privacy. Before starting any personal care activity, I explain the procedure to the patient, seeking their consent and involving them in the process as much as possible. This helps to reassure the patient and promotes a sense of control and autonomy. I ensure privacy by closing doors or curtains and covering the patient appropriately to minimize exposure. During the task, I use a gentle touch and respectful language, being mindful of the patient's comfort and preferences. I also remain attentive to nonverbal cues, such as facial expressions or body language, to gauge the patient's comfort level and respond accordingly. Additionally, I encourage the patient's independence by allowing them to perform tasks they are capable of doing themselves, offering assistance only when needed. This not only preserves their dignity but also supports their sense of independence and self-worth. 41. Can you discuss your understanding of health and safety risk assessments? Health and safety risk assessments are systematic processes used to identify, evaluate, and mitigate potential hazards in the workplace to ensure the safety and well-being of both staff and patients. My understanding of health and safety risk assessments involves several key steps. First, identifying hazards is crucial. This includes recognizing anything that could potentially cause harm, such as physical obstacles, hazardous substances, or faulty equipment. Once hazards are identified, the next step is to evaluate the risks associated with each hazard, considering the likelihood of occurrence and the potential severity of harm. After evaluating the risks, implementing control measures to mitigate or eliminate the hazards is essential. This can include practical steps such as removing obstacles, providing protective equipment, implementing safety protocols, and ensuring proper training for all staff. Regularly reviewing and updating risk assessments is also important, as it ensures that new hazards are identified promptly and that control measures remain effective. This involves continuous monitoring of the environment and consulting with staff to gather feedback on potential risks and safety improvements. In my role, I ensure compliance with health and safety regulations and protocols, conduct regular risk assessments, and promote a culture of safety by encouraging staff to report hazards and participate in safety training. 42. Describe your experience with providing care to pediatric patients. My experience with providing care to pediatric patients involves a combination of compassion, patience, and specialized techniques to meet their unique needs. I understand that children require a different approach compared to adult patients, and I adapt my care strategies accordingly. I start by creating a friendly and reassuring environment to help alleviate any fears or anxieties that young patients may have. I use age-appropriate communication, explaining procedures and treatments in simple terms that children can understand. I also employ distraction techniques, such as games or storytelling, to keep them calm and cooperative during medical procedures. In my role, I have assisted with various aspects of pediatric care, including monitoring vital signs, administering medications, and supporting children with daily activities such as bathing, dressing, and feeding. I am vigilant about observing for any signs of distress or discomfort and reporting these promptly to the supervising nurse or doctor. I also prioritize involving parents or guardians in the care process, keeping them informed and providing guidance on how to care for their child at home. Building a rapport with both the child and their family is essential for creating a trusting and supportive care environment. Overall, my experience with pediatric patients has taught me the importance of patience, creativity, and effective communication in providing high-quality care that meets the specific needs of children. 43. How do you handle situations where a patient or family member is upset or angry? When a patient or family member is upset or angry, I handle the situation with empathy, patience, and professionalism. I start by actively listening to their concerns without interrupting, allowing them to express their feelings fully. This shows that I respect their emotions and am genuinely interested in understanding their perspective. Once I have a clear understanding of their concerns, I acknowledge their feelings and validate their emotions, letting them know that their feelings are important and understandable. I remain calm and composed throughout the interaction, which helps de-escalate the situation and prevent further agitation. If the concern is within my capacity to address, I provide a clear and immediate response or solution. If it's beyond my scope, I assure them that I will escalate the issue to the appropriate person, such as a supervisor or healthcare provider who can provide the necessary assistance. I also provide information about the steps being taken to resolve the issue and set realistic expectations about the timeline and outcomes. Keeping them informed helps build trust and reduces anxiety. 44. Can you give an example of a time when you advocated for a patient's needs? In a recent instance, I encountered a patient who was experiencing communication barriers due to a language difference. The patient, who spoke limited English, was struggling to convey their symptoms and concerns to the medical team. Recognizing the importance of effective communication in providing quality care, I advocated for the patient's needs by taking proactive steps to ensure their voice was heard. Firstly, I engaged the patient in a calm and supportive manner, using gestures and simple language to facilitate understanding. I encouraged the patient to express themselves in their native language, even though I didn't speak it fluently. By demonstrating patience and empathy, I helped the patient feel more comfortable and empowered to communicate their needs. Next, I sought out interpreter services to assist with communication between the patient and the medical team. I contacted the hospital's interpreter services department and arranged for a professional interpreter to be present during the patient's consultations and interactions with healthcare providers. Throughout the process, I remained by the patient's side, offering reassurance and advocacy. I ensured that the interpreter accurately conveyed the patient's concerns and questions to the medical team, and facilitated clear communication between all parties involved. As a result of these efforts, the patient's needs were effectively communicated and addressed by the medical team, leading to improved understanding and patient satisfaction. This experience highlighted the importance of advocacy in ensuring that every patient receives equitable access to healthcare and has their voice heard, especially in situations where communication barriers exist. 45. Describe your approach to supporting patients with end-of-life care. Supporting patients with end-of-life care requires compassion, empathy, and respect for the patient's dignity and wishes. My approach begins with actively listening to the patient's needs and concerns, as well as those of their families. I aim to create a comforting and peaceful environment, ensuring the patient feels valued and cared for during this difficult time. Pain management and comfort are top priorities, so I work closely with the medical team to monitor symptoms and administer medications as needed. I also provide emotional support by being present, offering a listening ear, and engaging in meaningful conversations when the patient desires. Additionally, I respect cultural and personal preferences, accommodating rituals and practices that are important to the patient and their family. Clear and sensitive communication is vital, so I ensure that I keep both the patient and their family informed about the care process. By focusing on these aspects, I help provide compassionate and respectful end-of-life care. 46. How do you ensure effective communication with patients who have sensory impairments? Ensuring effective communication with patients who have sensory impairments requires sensitivity, patience, and adaptability. My approach involves several key strategies. Firstly, I assess the patient's specific sensory impairment and any assistive devices they use, such as hearing aids or communication boards. This helps me understand their communication needs and preferences. Next, I tailor my communication style to accommodate the patient's sensory impairment. For example, if a patient has hearing loss, I speak clearly and face them directly, using gestures or visual aids to supplement verbal communication. I also ensure that the environment is conducive to communication by reducing background noise and distractions. If a patient has visual impairment, I provide verbal descriptions of my actions and surroundings, using tactile cues if appropriate. I also offer assistance with reading documents or navigating the environment as needed. In addition, I encourage patients to communicate their needs and preferences, and I actively listen to their concerns and feedback. This helps to build trust and rapport, fostering a collaborative approach to care. Overall, by being attentive, adaptable, and respectful of the patient's communication needs, I ensure that all patients, including those with sensory impairments, receive the information and support they require to participate fully in their care. 47. Can you discuss your experience with maintaining confidentiality in a busy healthcare environment? In a busy healthcare environment, maintaining confidentiality is paramount despite the fast-paced nature of the work. Throughout my experience, I've consistently upheld strict confidentiality standards to ensure the privacy and trust of patients. To manage confidentiality effectively, I prioritize awareness and adherence to organizational policies and legal regulations such as GDPR, General Data Protection Regulation. I ensure that all patient information, whether it's electronic records or verbal communication, is handled discreetly and only shared with authorized individuals on a need-to-know basis. Despite the demanding workload, I remain vigilant about safeguarding patient information at all times. This involves taking proactive measures like securing patient files and electronic records using password-protected systems, and avoiding discussing patient information in public areas where it could be overheard. In instances where confidential information needs to be shared among healthcare team members for patient care purposes, I employ secure communication channels such as encrypted emails or secure messaging platforms. Additionally, I maintain professionalism by refraining from discussing patient cases outside of work or with unauthorized individuals, respecting the privacy of patients at all times. 48. Describe your understanding of the Mental Capacity Act and its implications for patient care. The Mental Capacity Act (MCA) is legislation designed to safeguard and Empower individuals who may lack the mental capacity to make specific decisions for themselves. My understanding of the MCA and its implications for patient care revolves around several key principles and responsibilities. Firstly, the MCA presumes that individuals have the capacity to make their own decisions unless proven otherwise. This means that healthcare professionals must assess a person's capacity to make a specific decision at the time it needs to be made, considering factors such as their ability to understand relevant information and weigh the consequences of their decision. Secondly, the MCA emphasizes the importance of supporting individuals to make their own decisions wherever possible, even if they require assistance or adjustments to do so. This may involve providing information in accessible formats, using communication aids, or involving family members or advocates in the decision-making process. Additionally, the MCA establishes a framework for making decisions on behalf of individuals who lack capacity, known as best interests decision-making. This requires healthcare professionals to consider the individual's past and present wishes, beliefs, values, and preferences, as well as any factors that they would likely consider if they were able to make the decision themselves. Furthermore, the MCA sets out safeguards to protect individuals' rights and ensure that any decisions made on their behalf are in their best interests. This includes the requirement for healthcare professionals to consult with relevant parties, such as family members or legal representatives, and to consider less restrictive alternatives before making decisions that may restrict a person's freedom or autonomy. 49. How do you handle situations where a patient is non-compliant with treatment plans? Handling situations where a patient is non-compliant with treatment plans requires a delicate balance of empathy, understanding, and assertiveness. Firstly, I approach the patient with empathy, seeking to understand the reasons behind their non-compliance without judgment. I listen actively to their concerns and perspectives, acknowledging any barriers or challenges they may be facing. Next, I provide education and information about the importance of adhering to the treatment plan, explaining the potential risks and benefits in a clear and understandable manner. I emphasize the positive impact that compliance can have on their health and well-being, while also addressing any misconceptions or fears they may have. If the patient's non-compliance persists, I collaborate with the healthcare team to explore alternative approaches or modifications to the treatment plan. This may involve adjusting medication dosages, exploring different treatment options, or providing additional support services such as counseling or social work assistance. Throughout the process, I remain patient and supportive, offering encouragement and praise for any progress the patient makes towards compliance. However, I also maintain boundaries and assertively communicate the importance of following the treatment plan for their overall health and recovery. 50. Can you discuss your experience with promoting infection control practices among patients and visitors? In my role as a healthcare assistant, I have experience promoting infection control practices among patients and visitors by leading by example and providing education on proper hygiene protocols. I emphasize the importance of hand hygiene, respiratory etiquette, and environmental cleanliness to prevent the spread of infections. I use clear and simple language to explain the rationale behind these practices, highlighting their role in protecting both patients and staff. Additionally, I ensure that hand sanitizer dispensers and informational posters are readily available in prominent locations throughout the facility to serve as visual reminders. I also engage in regular communication with patients and visitors, answering any questions they may have and addressing misconceptions about infection control. By fostering a culture of awareness and accountability, I empower patients and visitors to take an active role in maintaining a safe and hygienic environment. TIPS for passing healthcare assistant interview. Here are 10 tips to help you pass a healthcare assistant interview, whether it's with the NHS, a care home, or a co-regency. 1. Research the organization. Take the time to learn about the organization's values, mission, and services they provide. This will demonstrate your genuine interest and commitment to the role. 2. Understand the job role. Familiarize yourself with the responsibilities and duties of a healthcare assistant, including patient care, administrative tasks, and adherence to healthcare protocols. 3. Review common interview questions. Prepare responses to common interview questions, such as those related to patient care, teamwork, communication skills, and handling challenging situations. 4. Use the STAR approach. Structure your answers using the STAR situation, task, action, result approach to provide clear and concise examples of your skills and experiences. 5. Highlight relevant experience. Showcase any relevant experience you have in healthcare, such as previous roles as a caregiver, volunteer work, or relevant certifications or training. 6. Emphasize soft skills. Highlight soft skills such as empathy, communication, teamwork, and adaptability, which are crucial in providing compassionate and effective patient care. 7. Demonstrate professionalism. Dress appropriately for the interview, arrive on time, and greet the interviewers with a firm handshake and a positive attitude. 8. Ask questions. Prepare thoughtful questions to ask the interviewer about the role, team dynamics, training opportunities, and the organization's culture. This demonstrates your interest and engagement. 9. Practice interview techniques. Practice answering interview questions with a friend or family member, and seek feedback to improve your responses and confidence. 10. Follow up. Send a thank you email or note to the interviewers after the interview, expressing your appreciation for the opportunity and reiterating your interest in the role. By following these tips and thoroughly preparing for your interview, you'll be well equipped to pass a healthcare assistant interview and showcase your suitability for the role. As we wrap up this video on healthcare assistant interview questions and answers, we hope you've gained valuable knowledge and insights to help you succeed in your upcoming interview. Remember, preparation is key, so take the time to review these questions and practice crafting your responses using the STAR approach. By showcasing your skills, experiences, and passion for healthcare, you'll be well positioned to make a positive impression on your potential employers. Best of luck in your interview, and thank you for watching.